Welcome to Plastic Surgery 90210. My name is Ariel.
And I'm Dr. Katzen.
What are we talking about today?
Today we're talking about tummy tucks, or abdominoplasty is a medical word for a tummy tuck.
And there are different reasons why you might need a tummy tuck. Let's kind of dive into that.
Yeah, so basically I break it down into, there are only three things that can go wrong. Okay, it can be a skin problem, it can be a fat problem, it can be a muscle weakness kind of problem. And those are the only three reasons that you may need a tummy tuck.
And they can be combined.
Yeah, so not everyone usually has a pure defect of one of those three things. Not pure skin, not pure fat, not pure muscle. Some do, but those are pretty rare.
Okay, and let's talk about what you see most commonly in your practice.
Yeah, so in my practice, it's mostly after massive weight loss. And when we talk massive weight loss, what are we talking about? We're talking about at least 100 pounds of weight loss or more. Yeah, sure, we have patients that have lost, I've lost, 5, 10 pounds, but we're talking about, 100 pounds or more. We had a patient the other day who lost 240 pounds. That's amazing. What do you think is going to happen to the body after you lose 240 pounds? It's going to be a lot of changes. Okay, so the skin is made up of a lot of components. It's allowed to stretch. It's got this component in it called collagen, but more importantly for this lesson, it's got this component called elastin. And elastin sounds like
Elastic.
Elastic. So the elastin in your skin allows the skin to bounce back. But if you stretch out elastin's sort of like a rubber band. If you take a rubber band and you leave it on stretch, what happens when you take that tension off the rubber band?
It gets all crinkled up and wrinkled up.
Correct. The rubber band can't go back 100%. So it tries to, and that's what your skin does. It tries to bounce back after that weight loss. So just like pregnancy, it's stretched out for several months, and then it delivers the baby, and then the skin tries to bounce back. Same thing with weight loss. So the skin's going to bounce back, but never 100%. And it really doesn't depend on your age too much or the rapidity of your weight loss. Some people say, if I lose my weight slower, the skin will snap back. No, that's not true. Or if you're younger, the skin's going to bounce back better, but that doesn't guarantee that it's going to be 100%.
What about if it wasn't extended for as long? Do you think that matters?
No, I mean, the skin's been stretched out. If you take a rubber band and you stretch it once, or you leave it stretched out for 9 or 10 months, it's still on stretch. It still doesn't bounce back as much.
Got it. Okay. Yeah. And let's talk about the next issue. So that was more of an excess skin issue when people have weight loss.
Yeah. And the other issue is excess fat. So some people just have excess fat, whether they've lost weight or not lost weight. And that has to do with too much fat, either underneath the skin or behind the muscle. Okay, so when we're talking about fat underneath the skin, that's a sandwich between the skin and the muscle. And the muscle we're talking about is the six-pack muscle, rectus abdominis muscle. So you got the muscle below, you got the skin above, and you got a fat layer in between. And if there's too much fat in there, the tummy can look large.
And then that might lead people to wonder, should I just get liposuction if it's an excess fat problem?
But then the problem becomes, what do you do with the skin on top? Now, if you're young and healthy and have not lost a lot of weight, liposuction may be the answer. But if you've lost 100 pounds, if you're maybe over 50, maybe you have striations or stretch marks, maybe you have sun damaged skin, that skin's really not going to bounce back. You really need a tummy tuck. But if you've only lost maybe 5 or 10 pounds, maybe there are isolated pockets of fat, you're maybe in your 20s or your 30s, liposuction may be the answer.
Is there a good way to tell, maybe like if you're standing up and can pinch or anything, like whether you need a tummy tuck or not?
That's a really good question. So when you're standing up or even laying down, if you can pinch an area and if you have fat in that area, if you can pinch it off your body, that's probably fat, and that may be amenable to liposuction. If you can't really pinch that area and get a good grip on it and bring that off the substrate underneath, then that's probably not fat. That's probably just loose skin.
Okay, got it. And let's talk about rectus diastasis.
Yeah, rectus diastasis. Now what we're talking about is the rectus muscle. Think of those bodybuilders, those people that do the six-pack, the people that got those ripped abs. They're two parallel muscle structures which join the rib cage to the top of the pelvic bone. They're like sort of like handlebars, vertical handlebars going up and down like that. And they have those horizontal transcriptions, those belly insertions, which give it that six-pack look, that rippled look.
The 8-pack?
The 8-pack or the 6-pack, right. So you've got those transverse horizontal inscriptions. They're not separate muscles. It's one muscle. It just has ripples in it. Okay. Now, rectus diastasis technically probably should better be called rectus abdominis diastasis because it's the rectus muscle, okay? And diastasis is a separation. So the muscle, these are the two bellies of the muscle, get separated. And usually it's because of muscle stretch, something behind it, like weight gain, has pushed it out and stretched it, or sometimes pregnancy will push out those muscles and separate them.
And can working out fuse those muscles back together? How does that work?
It's difficult. It's difficult to get those. Once those are separated, it's difficult through diet and exercise to really get those corrected or brought back together.
Okay, and we see that a lot with pregnancies?
Yeah, a lot. Because again, that muscle's been pushed out from the inside. It doesn't get pushed from the fat on top of the muscle. It gets pushed out from the fat behind the muscle, like pregnancy or obesity.
And what kind of exercises can someone do if they want to try to repair themselves before the tummy tuck?
Sure. Sit-ups are a good one. The obliques, where you do the medicine ball, the Roman ball, where you go side to side, the external obliques. Crunches, planks, things like that. Things
so
that
core and abs.
Core and abs, exactly.
Got it. Okay, so we're going to look at a couple of pictures, and you can tell us what you think this patient, or why this patient needed their tummy tuck. So here is the first one.
Okay.
So what is your assessment here?
So the assessment here, this patient, again, break it down into 3 parts. Is it a skin problem? Well, a little bit. She has a little bit of stretch marks. Is it a fat problem? Well, a little bit. She has a little bit of fat. But mostly it's, I think, muscle problem. The muscle behind it, the rectus abdominis muscle, is sticking out. So she needs a tummy tuck to correct the muscle. The only way to really correct the muscle, rectus abdominis muscle, is with a tummy tuck. So we do an incision from the hip down to the pubic region and out to the hip, and go down to the muscle like you've seen on my other videos. Go up to the belly button, core out the belly button, go up to the sternum, find that 6-pack muscle, bring that muscle together. So with rectus diastasis, the muscle is sort of separated like that. I'll take a suture from there to there and bring that muscle together and imbricate it like that.
And here's the profile, if you want to talk about that.
Yeah, very good. So on the profile view, you can really see what's going on. You can see some stretch marks there. That's really not the major problem. But the reason this belly pooches out is because of the fat underneath the muscle. Okay, a little bit percentage-wise, but the majority, I'd say 90% of her problem is that the rectus muscle is either weak and the internal organs are pushing that rectus muscle out.
All right. And do you include the muscle plication? I'm going to show them the first picture again because I think it's really impressive how much curvier she got with this. But do you always include the muscle plication with your tummy tucks?
I always do because most of my patients are weight loss patients. So with the weight loss, the muscle, the rectus muscle has been distended because of the internal fat with the weight gain. And then that muscle has been stretched out, so it really needs to be corrected, imbricated, plicated with that rectus plication with the tummy tuck. So I include the rectus plication with my tummy tucks and body lifts.
Okay, let's go on to our next patient. This is a male patient, and he had a major tummy tuck here. Yeah,
so a patient lost a lot of weight, and this patient has mainly 3 components. The skin, again, break it down, skin, fat, muscle. All right. Is it a skin problem? Well, yeah, the skin is completely covering the pubic region. It almost goes down to his mid-thigh or even down to his knees. So there's a lot of excess skin. So if you just do liposuction, there's going to be more hanging skin. So is it an excess fat problem? Yeah, there is excess fat underneath the skin which needs to be taken care of. So it's a skin problem, it's a fat problem, and it's a little bit of rectus problem. You know, the rectus sticks out a little bit, but again, it's a proportion kind of thing. I would say on this patient, it's probably 60% skin problem, maybe 30% fat problem, and then the remainder rectus problem. So again, with the tummy tuck, we correct all these areas. And you can see on profile here, the significant improvement. That pannus, that hanging abdomen has been corrected because we got rid of skin, we got rid of fat, and we did muscle plication.
Also, you did something cool for him where you released his check rein ligaments. Do you want to talk about that?
Yeah, check rein ligaments basically hold the penis back. With the weight gain and weight loss, the penis actually gets buried in the surrounding skin. So one of the problems is these check rein ligaments, which are ligaments on each side of the penis, sort of like reins on a horse. Think of that analogy, keeping the penis back inside the body. And then you get, with weight gain and weight loss, this enveloping skin and fat which surrounds the penis. So the penis is sort of, we call it a hidden penis. So what we do during the tummy tuck is we're down in the pubic region, and I can release those ligaments to allow the penis to be not restrained anymore and come out more. So it's a cool procedure we do on male tummy tucks.
Here's another patient that we have here who got a tummy tuck. Let's talk about what her problem was.
Okay, so I want the audience to sort of break it down in your minds. We'll give you a couple of seconds. Tick, tock, tick, tock, tick. Okay,
follow
time's
us
up.
on TikTok.
Yeah, follow us. If it's still around. I don't know. They're trying to cancel it. This patient, break it down. Is it skin problem? Well, yeah, she's got a lot of excess skin and fat above the belly button. She's got a lot of excess skin and fat below the belly button. Okay. Does she have excess fat? Yeah, I think that's part of her major problems. She's got a lot of fat above the belly button, below the belly button. So we got to take care of the fat. And is it a rectus problem? Well, yeah, maybe a little bit because of her weight loss history. So she had, again, lost at least 100 pounds. So we need to do a tummy tuck.
A lot of patients I talk to say that doctors they consult with sometimes don't include the pubic lift and reduction with their tummy tucks, and people just wonder why.
Yeah, I'm not sure why. In fact, I think it's tomorrow we're doing a pubic reduction on a patient that had a tummy tuck by another plastic surgeon. So I don't know why. I mean, almost all of my weight loss patients, male and female, have something going on in the pubic region.
Right.
So that is included in my tummy tuck. So as the incision comes down low over the pubic region, here, I go down into the pubic region and take out that little ball of fat. Sometimes it's the size of a lime or a lemon or with my fist, but nonetheless there is a pocket of fat. We get that nice and flat to reduce it. So in my tummy tucks, you get removal of skin, removal of fat, rectus abdominis plication, pubic correction, and belly button revision. So that's 5 things you get on my tummy tucks. Included. I don't break it down and go, oh, you want the muscle fix. That'll be an extra. You want the skin removed too. Oh, that's an extra click. Oh, you want the pubic region. No, it's all included in that. But some plastic surgeons, for some reason, break it down. But almost all my patients need those procedures.
Does your metabolism change after a tummy tuck?
Yes. That's a really good question. So what are we removing with the tummy tuck?
Skin and fat.
Skin and fat. From what we know, skin doesn't control hormones too much, maybe with the sunlight a little bit, but fat controls the hormones a lot. Okay, fat is sort of like a sponge, okay, to absorb hormones. There's a lot of hormone storage in fat. So we have patients where we do a lot of liposuction, where we're taking out 5 liters or sometimes even more, and the patient has massive, huge mood swings after the liposuction. And that's because we're removing the fat and a lot of the hormone storage. With a tummy tuck or a body lift, absolutely. We're removing fat. We're removing a lot of the hormones. We're removing a lot of the insulation for glucose control. So by removing fat, we're actually able to help people control their glucose, their sugar better. So by removing the skin, and by especially removing the fat with the tummy tuck, your metabolism definitely has changed.
Okay.
Improved.
And do those mood swings like even out at some point?
Yeah, they even out. Everyone's different.
It just
takes a little bit of time. So we get patients with, oh, Dr. Katzen, I'm having these massive mood swings after liposuction or a tummy tuck. Yeah, absolutely, we do see that.
Okay. All right, and what do you advise for people like that?
Just ride it out. I mean, if you're taking hormone replacements, we may need to adjust that. If you take behavioral medications for your emotions, you may have to titrate or adjust that a little bit too. Don't go cold turkey. Don't stop all your medications. Work with your plastic surgeon, work with your psychiatrist, psychologist.
Okay, and someone was asking how to get insurance to cover their tummy tuck.
Ah, good question, the golden question. So that really depends on your insurance. All right. So I've had some patients with the best insurance in the world. They are CEOs of companies, and they're in charge of their insurance plan, and they have 50 to 100 people underneath them, and that's their company, all right? And they get the tip-top, premier, platinum medical insurance company. So their tummy tuck, no matter what their condition, usually will be covered.
Wow.
Okay, so their tummy overhang above their pubic region was maybe about that much. And they were stable weight, normal weight, not overweight. Their tummy tuck was covered.
Wow.
Because of their quality, their insurance. Okay, compared to other patients with basically the basic medical insurance, and their tummy can be below their knees, and their tummy tuck will not be approved.
Oh, so sad.
It completely depends on your medical insurance.
Yeah.
Yeah.
So what advice do you have for people? Is it worth it to go look for the best insurance?
It depends. You know, it depends on your financial situation. You know, if you can afford better health care, I strongly advise it, you know, because it just doesn't cover cosmetic surgery. It covers the more common things like if you get sick or, you know, have medical problems. It covers those things. Or you may want to look at it, well, I can't afford more health insurance, but I can afford a tummy tuck. So, you know, just go shopping around plastic surgeons who you feel comfortable with, who are experienced, and who are within your price range. I got a great joke for you.
All right, go ahead. You can tell your joke.
So what is a plastic surgery procedure called where you remove the body and the nose?
Ask it one more time.
What is a plastic surgery procedure called where you remove the body and you remove the nose?
Nobody knows?
Nobody knows. Yeah, pretty good, huh?
Okay, that's pretty good. And then you have your cup here.
Oh, we have my cup. I don't know if it's going to show up there. Oh, I'm going to bring it in. Oh, okay. A patient gave me this mug. Does it flip with the text? I don't think they can read it. Yeah, we can't read text because it's flipped.
It says, well, that's not a good sign. And the sign says bad.
So it's a bad sign. But anyway, yeah.
Is that a good joke or a bad joke?
It's a good mug.
It's a good mug.
Yeah.
Yeah, I actually like the joke. Thank you guys so much for joining us today on Coffee with Katzen, Plastic Surgery 90210. I'm Ariel.
I'm Dr. Katzen.
And don't forget to follow us on this page. We also have a main account at Dr. Katzen MD, and we post more on there. So we'll see you guys later. Thank you.
Thanks.
Have a good day. Happy Taco Tuesday.
Wonder what taco you're going to have.
Carne asada.